Good morning Year 12 and welcome to the first of your geography lessons from Dr. Allam's Kitchen. I hope you're all keeping well. It's been really nice to hear from you on email. Let me know how you're doing, how you're getting on, and of course sending me the work that you've been doing. Please keep doing that. And if you need any help, please just email me. So you will have had today's email because you've got this video open and you're watching it, and also on that email was a PowerPoint presentation which you will need to use in conjunction with this video. So there will be some points where I ask you to pause the video and have a look at the PowerPoint presentation and do some work from that, or to read through the slides or whatever. Okay. As you can see from looking at the PowerPoint, we are starting a new topic today, and it's one of the geographical debates topics which you'll be tested on in paper 3, unit 3, in your exams next summer. And this is a really big topic, and fittingly enough, it's all about the geography of disease, which is quite topical at the moment. So to begin with, you've got a title slide on your PowerPoint presentation with a quote there from Tom Frieden, who is the director of the CDC in the USA. If you just have a read through that. Obviously you will need a new section in your folders, perhaps even a new folder, because this is a really big topic, and make sure you keep your notes nice and neat. I would really encourage you to try and make notes like you would do in class, so be writing the title of each lesson with the date and be really rigorous about keeping a neat set of notes there. If you have a look at slide 2, you can see that we're looking today at the classification of diseases, and you have got a disease dilemmas glossary there in front of you. I would write this glossary out if I was you, so write it out by hand and keep that piece of paper as your glossary and keep adding to it as we go through the work. The writing out will help you to begin to remember these terms. So you can see we've got a number of terms here that we're going to look at, and these really are key terms. We're going to be referring to these terms lots and lots of times throughout this whole unit of work, and it's really important that you can remember the definitions of these terms and use them when you're talking to me and to each other, and of course use them in your written work as well. A lot of these terms are quite similar to each other and there are quite small differences between them, so they're easy to get confused, so it's really worth practicing these terms over and over again. You can see we've started with a term there called communicable disease, which is an infectious disease which spreads between hosts, and we are currently seeing the impacts of a disease like that, COVID-19, at the moment. TB is another example. Kind of opposite to that, you've got non-communicable diseases, and that's a disease which can't be communicated between people. It's not spread between people, and it's usually the result of lifestyle factors like being overweight or not getting enough exercise or smoking, for example. So coronary vascular disease is an example of a non-communicable disease. Diabetes or type 2 diabetes is another example of a non-communicable disease. Contagious diseases, again, COVID-19 is a contagious disease. It's one which is spread by direct or indirect contact with other people. So we can catch it by being in direct contact with other people, by them sneezing onto us, for example, or we can catch COVID-19 by touching a door handle, which somebody who is infected with COVID-19 has previously touched and left behind, something which is going to pass that on to us. And then if we touch our face or our mouth or our eyes, that infection can get into our bloodstream and make us ill. The next one is a non-infectious disease, which is a non-communicable disease that is usually the result of a lifestyle like diabetes. There are a few There are a few infectious non-communicable diseases, more on them later. The last 3 that you've got on there, so you've got 4 on there, the last 4 you've got on there. An epidemic is a disease outbreak which spreads quickly throughout a population. To begin with, COVID-19 was an epidemic within Wuhan and within China. That has now spread globally and become a pandemic. Diseases which are endemic are diseases which naturally exist permanently within a geographical area or within a human group. So, for example, malaria is endemic in some parts of Eastern and Western Africa. Sleeping sickness is an endemic disease of sub-Saharan Africa. And finally on there, you've got zoonotic diseases, and they are diseases which are transmitted from animals to humans. So an example of zoonotic disease would be rabies. If you get bitten by a dog which is infected by rabies, that can give you rabies. Again, if you get bitten by a mosquito, that can give you malaria. So they are zoonotic diseases. And you can see from looking at that quite a lot of diseases fall into different categories in there. They're not just falling in one category. Okay, so that's some key terms on the glossary, and I'd like you to write those out as a glossary now, please. Okay, if you look at the next slide, you'll see that there's a table there which shows the top 10 disease-related causes of death in the UK, and the same data for Malawi, which is a country in kind of Southeast Africa. What I'd like you to do is have a look at that table, and I would like you to describe the information shown and use examples of diseases whilst you're doing that. And then, after you've done that, I'd like you to try to think, well, could I begin to explain that information? Why do we see these differences in the types of diseases in these two different countries? And if you think about living conditions in Jembertown Bessie compared to Northwood, that might give you some help with beginning to explain that. Okay, so I'd like you to do that task now, please. Okay, your third task in today's lesson is to have a look at the next slide, which shows a map of Africa, and it shows the distribution of sleeping sickness in various parts of Africa, and the kind of reddish numbers which are shown in the key on the left hand side are the number of reported cases of one type of sleeping sickness, and the yellowish coloured areas, countries, shown on the key on the right are the number of reported cases in 2010 of a different type of sleeping sickness. And it also shows you with the stripy colours the countries where sleeping sickness is endemic as well. So existing permanently within the population there. Please can you describe the distribution of one of those types of sleeping sickness on that map? Okay, you will have finished that test by now, and what you should have noticed is that whichever one you chose, you can see that it's predominantly sub-Saharan countries around the Sahara, central and some parts of southern Africa which are impacted by this disease. Particularly, very high numbers of this disease are occurring in tropical areas which are around the equator. Presumably, therefore, because we can see that there are fewer reported cases of these diseases as you go further away from the equator, although in some countries it is endemic, presumably climate is having some sort of an impact on the distribution of this disease. You should have named some countries when you were doing your description as well. If you need to use your little atlas in your planner, or if you need to look online to check out the names of some of those countries, that's absolutely fine. But knowing the names of African countries and being able to label them on a map and use that information will be really, really, really important going forward with this unit of work. Okay, so we've had a think about classification of diseases, and we've also had I think about describing data on a table and how those different types of diseases vary in different types of countries, and we've also thought about describing distribution on maps. What we're going to do now is just move on to think about how diseases are transmitted, or how they are diffused, how they spread. So on the next slide, you have got a little list of things that you need to do. Okay, so on the following slides, I'm going to show you and talk to you about the 4 ways which diseases are transmitted or diffused or spread. They all mean the same thing. And I'd like you to make an information sheet for disease diffusion with all that information on one sheet. Okay? You need to include titles, diagrams, definitions, and examples of each diseases and where they're occurring, please. Okay? So have a look at the next slide. They're the diagrams that you need to include for the types of disease diffusion. And you can see that there are 4 different types of disease diffusion. Okay? The first one is called contagious diffusion. This is when a disease spreads through direct contact with a person who is carrying that disease, who is infected with that disease. And it's really important to remember at this point as well that people who carry a disease can either be asymptomatic, as in they don't show any symptoms and they themselves don't get ill, although they might pass that disease on to somebody else, maybe more than one person. Also, when people first have a disease, they might show no symptoms, but they might still have the disease and be able to transmit it to other people. And those 2 things have been quite important, haven't they, in terms of how we think about dealing with this global pandemic that we're now dealing with in terms of COVID-19. So, contagious diffusion is strongly influenced by distance, so the closer people are, the more likely they are to transmit it to other people. That's why social distancing at the moment is so important, because if we stay away from other people and literally stay away from them, as in stay at home and don't go out and about very much, and if we have to go out and about, we maintain at least 2 meters distance from them, that has and is really slowing down the spread of this disease and stops contagious diffusion. Examples include the COVID-19 outbreak right now, but also include the Ebola outbreak which occurred in West Africa in 2014 and 2015. Okay. So next one. The next one is called expansion diffusion, and if you have a look at the diagram you'll see how this works. But basically this is when a disease outbreak spreads into a new area whilst carriers in the original area or the source area remain infected. So the disease spreads, but people who had it in the source area still remain infected. TB is an example of this, and so is the current COVID-19 outbreak as well. Next one. The next one's called hierarchical diffusion. A hierarchy is something which has layers in a very specific structure. In this example, we're talking about a disease which spreads from areas of centres of connectivity, so maybe from big cities and to the edge of cities, to big towns, to small towns, and out to villages and rural areas. And this disease, hierarchical diffusion, can also happen along transport links like road and rail and air as well. Because of course they represent centres of connectivity, but they're also like moving centres of connectivity that can literally carry the disease from one place to another. In 2001, there was an outbreak of a flu virus called H1N1, and that became a global pandemic through air travel and spread at airports, basically. And so we are not in a necessarily completely new place with the COVID-19 outbreak. We have seen these global pandemics before, and in fact H1N1 killed about 12,000 people in the USA alone, so very, very high numbers of deaths and sort of similar numbers of deaths to what we're thinking about at the moment with COVID-19. COVID-19 is also an example of hierarchical diffusion. The final one is relocation diffusion, and this is when a disease spreads into a new area and the people in the source area are no longer affected. So this is a bit like the counter-argument to expansion diffusion. In 2010, there was, in January 2010, there was a really damaging earthquake in Haiti. And following that earthquake, a lot of aid workers went to Haiti to try to help with the clear-up operation in Haiti. And unfortunately, some UN aid workers, from Nepal, unbeknown to them, took with them and then transmitted cholera to Haiti, which killed about 7,000 people in Haiti due to that outbreak. So there wasn't a cholera outbreak at the time in Nepal, but people were still infected with the disease and still infectious. And so they transmitted that disease by going to Haiti, so really relocating the disease itself. So you should have a really nice single sheet of paper there with the 4 types of disease diffusion on there, and the diagrams, and also some examples and places where these types of diffusion have happened. A little bit like the key terms that we looked at the beginning, diseases don't fall neatly into single categories of diffusion. There can be multiple methods of diffusion for one disease, which again can make it very difficult to prevent and stop the spread of some diseases, and I think we can all recognise that we are perhaps encountering that situation at the moment. What I'd like you to do to finish off Year 12 is I'd like you to make sure that you add the 4 different types of diffusion to your glossary, please. And then all those terms that you've now got on your glossary, I'd like you to try and learn them for Friday's lesson. You can do that however you like. You might want to start up making a bank of flashcards, or what's going to become a card sort eventually, but that would be really, really good little revision task to sort of keep on top of as we go through this disease topic, because of course it's very new. You've probably not done geography really like this before, and so learning the key terms is going to be absolutely crucial. Okay, so that's for Friday's lesson, please. So I hope this new weird form of teaching has been useful to you. I have basically looked at myself for the last 16 minutes as I'm talking to myself, but actually I'm talking to you, so that's quite weird. Please let me know any feedback that you have, anything that you want to tell me, let me know. And I hope you're all keeping safe and well, and I will imagine that I'm seeing you again on Friday and make you another video for lesson 2. Okay, take care.